Hi, my name is Jimmy Sylvia, and for those of you that don't know me, I'm Chambers County Judge. Have been for 24 years. We're in our 4th month of COVID-19. Our lives have changed dramatically from what I'm sure we all expected for 2020 to look like. However, now, more than ever, we need to stand together by staying apart. Our case counts are rising rapidly, and you, the citizens of Chambers County, are the only people who can slow the spread. I'm here with Dr. Clay Brown, our local health authority, and Mary Beth Best, Director of Health Services for the county. We want to remind you that we all play a very important role in keeping our families, our communities, and ourselves safe. We can all do our part by staying home, practicing social distancing, and maintaining good hygiene. I'll let Dr. Brown and Mary Beth expand more on trends, best practices, and ways that we can all stay safe during these trying times. And then we'll talk about some frequently asked questions. Dr. Brown.
Thank you, Judge. I just want to echo what Judge Sylvia has said. Bottom line, we're here today to ask for your help in restricting the spread of this disease in Chambers County. The virus hadn't gone anywhere. In fact, there's probably more virus out there than at any time during this pandemic so far. And we'll talk a little bit as we go along about the evidence of that. But coupled with that is we've all relaxed a little bit. And more people are getting out, fewer people are wearing masks. We're tired of this. People are getting lax. And so here at the health department and at the county, we're trying to kind of remind everybody. At this point, I'm going to introduce Mary Beth Best. As you all probably know, she's the director of our health services.
No, basically, I just like to echo what Dr. Brown's saying, is that we realize that the case counts are going up, and with the reopening of Texas, we definitely have seen a case trend upwards in the county, and so I know that we're going to talk about those case trends upwards with some percentages that we have been posting on the Facebook page and on the website, especially over the past week. Since June, and specifically since Texas started reopening in May. And we get asked a lot of questions about why that is, or about increased testing, and it's probably due to a lot of things, and I think Dr. Brown may touch on those specifically. But we've had a 54% increase in cases just since last Monday, and we've had an 88% increase in cases since June the 1st, which that represents 60 new cases. And since Texas started reopening on May the 1st, we've actually seen a 200% increase in cases here in Chambers County. So with that, I'll turn it back over to Dr. Brown.
Yeah, and with those numbers, we've had more cases since June the 1st than we had since the pandemic started. Is that correct?
That's correct.
So, it's an issue.
Okay, this time let's go through some frequently asked questions. Those questions and answers should give you most all the information that needs to be given to you today. We'll go right into those. First one, is there a stay-at-home order in place for Chambers County? And the answer is no. No executive order is in place for stay-at-home in Chambers County. However, Governor Greg Abbott says all Texans should avoid gathering in groups of larger than 10. We're recommending that you stay home when possible. Just because you can do something doesn't mean that you should do it, and it's safe for you to do it. How is COVID-19 spreading in Chambers County? This time there's a widespread community transmission. Since June 1, roughly 25 to 50% of cases have been due to familial spread, while the rest was due to community spread.
And I can kind of expand upon that a little bit. We do get asked this question quite frequently, and sometimes we can identify that through contact tracing on our cases. And initially, whenever we began having cases in March, we could identify those early cases were through some were travel related, some were work exposures, and some were just out and about in the community. Recently, as of probably the end of May and into June, what we're identifying is that some of these are just cases related to just social gatherings. Some are, like Judge Sylvia said, are cases that are transferred in families, familial spread, as well as some work-related exposures. Not many travel-related exposures unless they're related to a social gathering from a travel scene. And we have had a few that have been from like restaurants, bars, things like that. So I hope that helps answer that question.
All right, next question. Why is the number of COVID-19 cases increasing in Chambers County?
We don't know exactly on this issue, but it's probably not coming into Chambers County. It's probably we're giving it to each other, and it's passing from person to person within Chambers County in any of those locations and in any of those instances when Mary Beth mentioned, and to everybody getting lax, and I'm going to say it, not taking personal responsibility and doing the adult thing, and worrying about your neighbor as well as yourself. You want to add anything to that?
I got a follow-up question on that. Is our percent increase the same as the region, the Southeast Texas region?
Off the top of my head, I don't have exact numbers, but I would say that we are probably right in line with the region increase. I know that when Governor Abbott spoke yesterday, he spoke specifically about some case counts going up in the state due to congregate settings or jail facilities or meatpacking plants or nursing home cases, but we've not been testing those. We've tested those places in the county, but our cases are specifically going up from individual cases and are not due to case increases because of congregate settings.
Or nursing homes. Our nursing homes have done great.
Yes.
Okay, can you give us a little guidance regarding wearing masks, who should wear them, when should they be worn, etc.?
Well, everybody should be wearing masks. Technically, if you're 6 feet away from people, you're not required to wear a mask. I would suggest if you're out in public, you wear a mask everywhere you go. Outside of your car, outside of your home. If you're walking into, I don't care how much if you're walking into Walmart, if you're going out to eat, if you're going to the gas station, if you're going to work. I mean, if everybody wore a mask, we wouldn't be seeing this big of an increase. So I wear a mask just about everywhere I go, and especially if you have, underlying conditions. If you're over the age of 65, if you're being treated for a chronic disease, if you have immunosuppressive disorders of any kind, you really should be wearing a mask everywhere you go. So I'm encouraging everybody, if you're out and about, to have a mask on.
And if nothing else, you're setting an example.
Exactly.
I mean, you feel like the odd person because you walk in there, and I've been to meetings where I'm the only one who has a mask on. But maybe at least a few of those are thinking about, maybe I should have that mask on. So.
And I realize we don't have a mask on right now. We were just
We just took
prior
them
to
off
walking
so we
in,
can
literally.
talk in here. I mean,
Yeah.
you can't.
I tried to talk through it, but it didn't work very well. All right, when are the county rental facilities, community buildings going to be open? That's a good question, and that we're not for sure, but it's very likely that those rental facilities will be closed through the end of this year. We don't have the staff to monitor the number of people in those buildings. We don't have the staff to clean the buildings after use like they should be. So it's very likely that they will be closed through the end of this year. but we will be coming out with those directives soon. The public do to keep their families safe. Stay at home whenever possible. As I said earlier, you don't have to go out just because it's open and you can go out. Wear a mask whenever appropriate, whenever you can, all the time. Practice social distancing that we've been preaching and preaching and preaching. Good hygiene. Wash your hands. One of the simplest things to do. Wash your hands, sanitize. I mean, that's my recommendation. Dr. Brown, Mary Beth, you want to add to that?
I would just add, if I were a parent right now, I would make sure that if I were sending my kids to summer school or to a camp or to athletics, I would make sure that screenings are being done when they go to those places, that temperature checks are being done. You know, when you go to your job, I would also make sure that temperature checks and screenings are being done there appropriately as well. Because of the amount of community spread we've seen throughout Chambers County, and all of those locations as well, you know, work sites, and so I would just make sure that those are being done to protect your family and those you may come in contact with.
Thank you. Anything else, Bill?
I would just add that, you know, this stuff spreads in families like wildfire. If somebody's sick at home, don't wait. Go get them seen at the family doctor, urgent care, or the ER. Get them seen, get them diagnosed, get them tested, and even isolate a little bit more until those test results come back, and you know that that's not what you're dealing with. And I would treat everybody you meet like there's a strong possibility they have the virus.
Thank you, Doc.
Yeah.
Hi, what can businesses and organizations do to keep their employees and patrons safe during the pandemic? I'll kind of tell you what we do here at the courthouse. The employee entrance, you walk in, there's a table, and the first thing you do is sterilize your hands. First thing you do is put your mask on before you come in, because if you come into a county building, you're required to wear your mask. So you put your mask on, you sterilize your hands before you touch anything. You pick up the thermometer, and it takes about 2 seconds to get your temperature. You write it down, and you answer the couple of questions, and then you're screened. You're free to go, free to come into the building. And if one of the questions is yes, or your temperature's above 100, right, or 100 above, then you're not allowed to enter the building. And this is a measure that is so simple, and I don't know why every business right now doesn't have this. Doesn't have a big jug of hand sanitizer at the door when you walk in, so you're forced to wash your hands and screen in, at least answer some questions. But
I think you covered it, just screening, you know, practicing routine screenings, trying to wear masks in common areas when you're in buildings. If you have frequent interactions with the public, employees and the public wearing masks, trying to social distance, taking, if you can, you know, appointments with the public, just encouraging everyone to wear a mask whenever they have those interactions, only because of the symptom onset 48 hours before.
And I didn't mention sneeze shields, but everywhere where the public deals with a county employee, we have a sneeze shield in place. Okay, where can citizens get tested for COVID-19 in Chambers County?
So we have had the ability to test throughout Chambers County pretty much since the middle of March, and those places we have them in all parts of the county. In Winnie, you can get tested at Riceland Hospital, also at the clinic in Mid-Chambers County, at Bayside, as well as Bayside Hospital. West Chambers County, there's several places in West Chambers County, Patients ER, West Chambers Medical Clinic. There's several urgent cares as well as private practices. We just urge everyone to call your primary care provider. If you're sick or if you have been exposed to someone, call your primary care provider. Tell them what's going on, and they will advise you of what you should do. If you don't have one and you have questions, call the health department. We will kind of also help you out in where you should go. There's currently no drive-through testing sites in Chambers County. We've had 2 separate ones. We're hoping to have one again in the near future in partnership with TDEM and the Texas Medical Department or Texas Medical Division. And also people can log on to readyharris.org in Harris County to go through a free drive-through testing site. We just urge you, if you go have that done, please call the health department with your results, because it does take us an extremely long time to get your results.
How does Chambers County identify people who came in contact with someone who tested positive for COVID-19?
So basically what happens with a positive case is whenever someone gets tested for COVID-19, we receive their lab results at the health department. It is a immediately notifiable condition through the DSHS. It is an immediately notifiable condition, so providers in Texas are required to report that to the health department. So we receive those lab results, and if it's positive, then we will call the patient and let them know their lab results. And then our epi investigators do a thorough case investigation with a positive case. And once we do that, we identify symptom onset, everything about that case. And then we start identifying their contacts, basically where they've been, who they've been around, and we identify who they've come in contact with. An exposure level means less than 6 feet for more than 15 minutes. And just about a month ago, I think it was less than 6 feet for more than an hour. And so CDC has basically changed their criteria due to the contagious nature of COVID-19. So once we do that, we identify all of those contacts. Then we start, which that's called contact tracing. Then what we do is basically we start calling those contacts and notifying them of their exposure. And this information is confidential. We never notify these contacts of who they actually came in contact with, because this information, again, is confidential. So the person who is positive, they are placed on home isolation. So the positive case is placed on home isolation. They can't leave their home. They are to be separated from everyone else in their home, and we give them very specific instructions. And they are to remain at home until their home isolation is over, and that is determined by their symptoms. And so their contacts are contacted, and they are placed on home quarantine, which means that they have come into contact with someone who's positive. There is a good chance that they could become positive. So they must remain on home quarantine for 14 days. They also are to remain at home, not to leave their house. They are also given specific instructions on what they can and can't do, which means not to leave their house. And this way we can help contain the spread of COVID-19 throughout the community. And these people are given this set of instructions to give to their employers if needed by the health department. So I hope that kind of answers those questions, and there may be some other questions related to that, because we do get a lot of questions about that.
Yeah, because people don't know, they don't understand the process. So if I test positive, who's going to know that I tested positive?
So if you test positive, you will know, your healthcare provider will know, whoever did your testing. The health department will know, because again, it is a state requirement that it is a notifiable condition. And then the only other people will know is who you tell. We don't notify anyone else. So unless you tell someone, no one else should know. We don't notify any contacts or anyone else.
Okay, thank you. All right, what's the difference between isolation and quarantine?
So the difference is isolation is a positive case, and a quarantine is someone who is in contact with a positive case. And so one of the questions we get frequently is if we put you on home quarantine because you were in contact with a positive case, well, if I just decide to go get tested just to see if, what my test result is, if your test comes back negative, you still have to stay home for 14 days, because any time during that 14 days, you can become positive, because that's the incubation period is 2 to 14 days. So if you have a negative test on the first day you're on home quarantine, on day 14 you can become symptomatic and can have a positive test. So it doesn't matter, what your tests say. You can be tested every day. On day 14 you can still have a positive test. So that's why those 14 days means 14 days. So.
And likewise, for the positive tested people that are on home isolation, they have to be on home isolation for 10 days at least, and be asymptomatic for 3 days before they can go back to work and get off the home isolation status. Even if 3 days into it, they go get another test and it's negative. And the criteria for going back to work or back to life and as outside of isolation isn't a negative test anymore. It's 10 days from the time you got sick or got diagnosed, whichever's earlier, and 3 days asymptomatic.
Yeah. So and sometimes it takes people longer than that 10 days
To feel better.
not have
Yeah,
symptoms or
absolutely.
get out of the hospital or whatever the case may be.
Mhm.
So that's why we're closely monitored by the health department as well as a lot of times the primary care provider, and the health department will will work with we work with the patients just to give them that date of being released from home isolation.
Thank you. How strict are home isolation quarantine orders?
So one of the things I think
Strict.
we didn't cover is how strict is it, and if someone's on home isolation or home quarantine and they're out and about, first of all, a lot of times people know, or you've told people that you're on home isolation. If they see you out and about, they call us. I mean, they call and they see Facebook postings and they do call us. Dr. Brown is a local health authority, can put a control order on someone to stay at home. I know he can probably tell you he doesn't want to have to do that.
No.
But because there's asymptomatic spread of COVID-19 before you're symptomatic, I don't think that you want to be positive and then we call you and ask you who all you were around. I don't think you want to tell us that you were around 10 or 12 people when you were supposed to be staying at home, and you just exposed all those people when you knew you were supposed to be at home.
You've taken the risk of getting other people sick, and if that gets to be a problem, most of these orders, most of these isolations and quarantines that Mary Beth described are basically kind of, we give you some instructions and kind of expect that you're going to follow them, and they're kind of voluntary. Okay, we'll call you every day. Please be home when we call you, but we're not going to, drive by and, you put a leg monitor on you or anything like that. But if it gets to be a problem that you have this disease and you're going out and about in public and we find out about it, it can get to the point where we can make it a legal issue, and I sign a control order, which brings with it, penalties and enforcement type things if you do go out and spread the disease after you've been asked not to. So that doesn't happen very often, but it can happen, and it's not something we want to do. We're on your side. We're on the side of the county and everybody in it. Nobody up here wants to be authoritarian or have police functions and that kind of thing. So we really ask that if you get a call from us asking you to stay home for either one of those reasons in either one of those fashions, please comply with it. It's better for everyone.
And remember, if you're a county employee, you are setting an example for our community.
Right.
Okay, how do I know if I need to be quarantined? Does someone call me? Does my family also need to be quarantined if I'm quarantined?
Yeah, so this kind of goes into I'll kind of go over these next couple ones. So yeah, if you need to be quarantined, if you've been identified either as a positive case or a contact of a positive case, you'll get a phone call from the health department. If you don't get a phone call from the health department, it either means that you've not been identified as a contact, or if you're a positive case in Chambers County and you've not gotten a phone call from the health department,
Please call us.
it means we don't know you're positive. It means that the lab didn't send us your positive case, or your provider didn't send us your case, and we don't know about it. And we would really like for you to send us your case, just so we can follow up on it. We can make sure there's no other contacts out there who potentially could be spreading it to someone else, because we know that there's no one out there who would willingly want this spread to continue in the community. And so if a family member, if you're quarantined at home, it doesn't necessarily mean your family needs to be quarantined. If they weren't exposed to a positive case, they don't need to be quarantined unless they were directly exposed. Also, we get asked a lot if people say, well, my employer says that those stay-at-home orders are just a suggestion. they're not mandatory. Well, like Dr. Brown said, they're not mandatory. They are a suggestion, a strong suggestion, only because if you are exposed to COVID-19 and you continue to go to work, and on day 4 you test positive, 2 days before that you just literally exposed your entire office, and so 6 or 8 or 10 people are going to be taken off work, and so those, you just completely shut down an office. And so that's why we like to even, and we don't mind helping educate employers or giving them, or you can give them a copy of your letter which explains the reason why home quarantine is so necessary. And also some employers are telling their employees that home quarantine is only 7 days, and it's not. CDC guidance is 14 days because that's the incubation period, is 2 to 14 days. So, and that's just the truth of it. And again, it's only just to keep the community safe. We just really are stop trying to contain the spread right now since it's just out there.
Thank you, ma'am.
Mm-hmm.
Why do some places have screenings and others don't?
I'm gonna tell you, I don't know. I don't understand it, because as a place, as a business, an office, a church, a school, an event, a party, I mean, even a party at your house, I mean, to not screen and not try to comply with some of the screening issues, to me is just saying that you don't care if you let somebody into whatever kind of place you have that has COVID, and that could spread it while they're in your place. So in my opinion, it's where it's not being done, it's just a lack of personal and community responsibility, and I'll just say it. I mean, it really is not taking responsibility for whoever it is you're letting into your whatever or wherever you work. And and the consequences aren't just for that person or the patrons. I mean, in some cases, if there's enough cases that we identify in any certain place, I mean, it can result in shutting your business down for 14 days. And so that's actually, just another aspect of this thing. If we get a bunch of cases in one place, that can happen too. So that's my take on why some places do and some don't. I don't get it.
Okay. Thanks, Doc.
You bet.
Mary Beth, anything?
All I had was just, I'm sure that, I know a lot of people look at the numbers that we post daily and can see the different trends, especially if you look on the actual website and you look at the dashboard. Our cases we have a higher count of females that are positive, as well as we have a high case count in our 30-year-old range, as well as I think in our 40-year-old range.
Yeah.
We've had a higher count recently under the 20-year-old range, and we've had a big jump even under the age of 10. So I think that's why it's important just to maybe spread the message even to the kids, of what it means to social distance, wash your hands, and just really think about those social gatherings. Like the judge said, I mean, the orders still from the governor are the minimum guidelines state less than 10, and what we do hear a lot about is that, don't be fearful. And I don't think it's necessarily being fearful when you to do these things. I think it's just literally being smart, having some personal responsibility, and then just showing others that you care. And we really want to slow the spread, in Chambers County, and being smart for one another, and just generally protecting each other.
Okay, so 24 years that I've been judge, we've had a lot of disasters. I mean, I don't know, maybe when I retire one day that we'll quit getting them. Maybe it's me, but we've had hurricanes, we've had floods, we've had airplane crashes, and now we've had a major pandemic we're in the middle of. I just want to say how proud I am of Chambers County employees and the work they do, and how well we all work together, and the community and the community understanding that if you come into a county building, that you're going to have to take these precautions, because we want to protect you as well as our employees. So that about wraps it up. If you have a health related question, do not hesitate to call 409-267-2731. I guarantee you they'll get you an answer. Any kind of health related, about quarantines, about contact tracing, about do I need to quarantine because this person I know, there's no stupid questions. Call and ask.
Call. That's what we're here for.
And if you have a question about any other general, anything else that's general, call my office at 409-267-2440. I want to say thank you. Be safe out there.